Hello, everybody. This is Allie Orwig with the Indiana Rural Health Association. We really appreciate you being with us today. We've got a great presentation for you here about RAP payment automation. We will be recording today's session, so if you're not able to join us for the entire session, it will be up on our YouTube channel early next week. Also, if you have questions during the presentation, please use the chat or Q&A function to send those in. We'll have some time for questions at the end, but I will try to moderate those as they come in during the presentation. So without further ado, we again appreciate your time, and I'm going to go ahead and turn it over to Melinda.
Hey, everybody. Thanks for joining us today. I'm not sure if you would like me to pause a little bit between each slide to see if there are any questions or if we just want to hold them for the end.
Entirely up to you.
Okay. Well, let's just wait till the end then and ask questions so that way we can get through the slides fast and have more time for questions.
Perfect.
So I just wanted to have this meeting today so that we could all discuss the automation project, which went live for the medical RAP automation and the behavioral health automation on July the 1st. There have been some issues. Oops, I hate when that does that. When we've noticed some claims coming through, so there have been some problems. So we wanted to go over this with everybody, make sure everyone is on the same page. So currently, when you bill your fee for service, it's already billed with the T1015. So there are no changes to that. What we were changing is the managed care claims and how they are billed. Before, you just billed your managed care claims and then you sent a manual RAP request to Myers and Stauffer for them to process the RAP payment. And then at the end of the year, you would have a reconciliation. And we are trying to step away from that year-end reconciliation process because it's kind of clunky. And so the whole idea of the automation was to make this a little more streamlined. So as of July the 1st, it is a requirement that all centers and clinics put a T1015 on their managed care claims when they're submitted to the managed care entity. The managed care entity has been instructed that when that T1015 code comes in, they're supposed to just pay it at zero and pretend like it's not even there, pay the encounters like they've always paid them. And then when they send their data file to Gainwell, Gainwell will see that T1015 and recognize that it needs a RAP payment, and they will look at all of the factors that they're supposed to look at and process that automated payment and send out a payment to you in the next check run. So like I said, beginning on July 1st, that's when this was supposed to have taken place. So as of July 1st, any payments or claims that have dates of service on or after July 1st, you're no longer supposed to request a manual RAP payment from Myers and Stauffer, but you are still able to submit those manual RAP requests for payments with dates of service on or before June 30th of 2021. So the Myers and Stauffer created a new manual RAP request form that they have available on their website, and they may have sent it out to you guys already. And it has it broken down so that you can put in there, you know, what those are for, if they're claims for Anthem between January and June, or CareSource and so on. And those are the ones that you're supposed to be using now. We've run into some known issues where there are some claims that are going through to the MCEs where there's no T1015 on it. So the way to fix that is if you notice that you have not received a RAP payment for a claim, if you go back and you look at your claim and you see that you forgot to put that T1015 on there, all you have to do is void that claim out and resubmit it with the T1015 so that it'll reprocess through the system. We're also getting some complaints from some of the FQHCs have noted that the patient number field that appears on your remittance advice is not populating with the account number that they have issued to that member. So we're working with some of the Gamewell folks and the MCEs trying to figure out a workaround or some solution to this. There's also been a problem with Anthem requiring that you use their member ID, which starts with YRK, on the claims when you submit those. However, after speaking with Anthem, they've told me that they have a crosswalk in their system now that you can bill with either the Anthem ID or the Medicaid RID number. And what'll happen is when you get your EOB back from them, it'll have the Anthem ID instead of the RID, but it will still process through the system. In November, they plan to go live with a change that they're making to how you receive your EOB. Starting in November, I think it's mid-November sometime, you should start seeing both the Anthem ID and the Medicaid RID on your EOB when you receive that with your payments. And there have been some of the FQHCs have had trouble trying to figure out where the wrap information is on the remittance advice. And I've got a sample of what that page looks like. So towards the end of your remittance advice, you'll be able to see a page like this that says wraparound services expenditures. And that is where you will find the information. It will have your patient RID number, the claim number, and this is the patient number field I was discussing that we're having some issues with it. MedWise and United Healthcare right now currently put the claim number that, or patient account number, whichever you put on the claim, will show up in this field. And MHS, Anthem, and CareSource are putting their own claim number in here. So it's causing a little bit of confusion, but we hope to have a solution for that soon. Starting, it was supposed to start this month. It'll probably be October. You should start seeing a new field on that remittance advice, and it'll be the sum of all payers. And it'll appear somewhere between the billed amount and the wrap payment that you receive. So the FQHCs approached us with some questions and concerns and maybe possible solutions. They wanted, first and foremost, the remittance advice to be completely automatic as far as posting. So we went back to Gainwell and had several discussions and found out that in fact, it is already configured that way, that if you download the 835 file, it should post automatically in every aspect. However, I guess individual software companies have not modified their software to accept an expenditure as a payment. So that may be something that if it's not posting automatically, you might speak to your software folks about so that they can allow that expenditure to be considered a payment. They want us to modify this wrap report that is on the remittance advice, and they want the layout to be changed. But the problem with that is that the way it is set up now is the fee-for-service wrap payments are in the section with the regular Medicaid payments, because it's really truly a Medicaid payment. It's the whole claim is paid by Medicaid. So the difference between that and the automated wrap payment is that the wrap is just an expenditure because the MCE has paid that claim. So what happens when that report comes over is Gainwell looks at that and says, well, MCE paid this, there was TPL that paid also, so this is what we owe. And they generate an expenditure. So that's why it's separate on the remittance advice, and they really don't have a way to make that look different. And another thing that they've requested is they would like to have an Excel report that would be available on the portal for them to download once a month or whatever frequency they want, so that they can track the payments that they've received, the wrap payments, for reconciliation purposes. That is something that we are still talking about internally. We're not sure if that is something that we want Gainwell to do yet, but we will keep people posted on that. I also have a billing guideline that I just kind of made a little cheat sheet for everybody, so that I know that when I was a provider, I had I made my own cheat sheets when I was doing something so that I didn't have to keep looking things up and going back and referring to, PowerPoint presentations or modules or anything like that. So I just made a little one pager that I'm going to send to the association so that they can share with you. And it's for billing guidelines, and it just basically tells you, the things that you need to remember when you're posting your, doing your claims and processing those. And it also has my contact information on there. So if you have any questions, you can reach out to me. Or if you have problems with your claims, you can reach out to me and we'll look into it and see what we can do to get those problems resolved. So that is actually the end of my presentation. I wanted to make it short and sweet for you guys today, and then see if you had any questions that I could answer, or if you had any issues we needed to talk about today. Were there any questions in the chat, Allie? I have a question for all of you. Are there any of you that are having issues with your claims and receiving your RAP payments? Oh, Maria, if primary insurance pays more than our T1015 rate, is it okay to not bill the managed care secondary? I assume that should not be a problem since you're receiving more than what your PPS rate is from the commercial insurance. It shouldn't be a problem for you to not bill the secondary insurance because you're just going to get a zero pay anyway.
Sorry about that, Melinda. I was just rattling on with it on mute, as you do.
I know, I do that too. And then I go, oh, darn it, I was on mute.
Yes. So generally what I was saying was that we appreciate everybody's time today. Obviously, a lot of information in a short period of time, but a lot of time for questions. So please do submit those. Or if you would like to ask a question verbally, use the raise hand function and we can unmute your line. Okay, well, I'm not seeing anything come in and I don't see anybody that has raised their hand. So just appreciate everybody joining us. Again, we will have this presentation on our YouTube channel by early next week. And we hope everybody has a wonderful rest of your Friday and a great weekend as well.
Yes, thank you.